But first, we thought it was interesting, as we are all together here, to discuss a little bit about the trends in the industry, what's going on, what's happening. It seems like the last 2 years have been very, very intense for the sector. It seems like things are speeding up, but they have been speeding up since the very beginning, I guess. So I would love to start the panel by asking about those trends. I mean, where do you see the e-health investment in the coming 3 to 5 years? What are the main areas of great interest? What are the things that you believe are worthwhile signaling about the future? Maybe we'll have the micro. Michael, you start.
Yeah, happy to. So one observation that we have made over the course of the last maybe 4 years is that the e-health applications or digital health applications have started to target very narrow applications, so like spotlight or piecemeal approach, and usually we have turned them down because we have the firm conviction that if such an application wants to be successful, it needs to address all the players in the whole ecosystem and not just one particular party. And we now see more and more applications and companies addressing a whole series of steps in the process instead of just a single thing, and we believe that's much more successful.
Marta, please.
I see a new maturity in the sector, especially when it comes to diligence in understanding the value proposition, clinical-driven companies that really seek evidence of outcomes in ways that wasn't true before, and not just clinical outcomes, but also economic outcomes. And I see emerge a new generation of companies that have taken to heart the recommendation that was given and not always listened to the previous generation of companies, at least in the US. It's not easy. I would say the clinical trial framework is really not suited for demonstrating the quality of interventions in digital health, so it needs some rethinking. And the most innovative companies are those that are rethinking altogether both the process and the types of outcomes that they need to demonstrate.
I think one of the things that both investors and startups are starting to come around to is that there are very few pure tech companies in the healthcare space, and this realization that having the services wrap around to the technology will help. That is okay. Will help you get adoption faster, and I think to the point of having either kind of this point solution versus platform argument. Point solutions can only really be successful if you're carving out risk for that population and providing actual services that go with your technology. I think that's something that investors have kind of been looking for, pure tech multiples in the healthcare space, and they just really don't exist. And coming to that realization that you have to have services and it takes longer to adopt will help us get there.
Well, we are a business school, a general business school. So we're not specialized in health, but we are very surprised that recently is a new generation of entrepreneurs, and between them we are looking how there are appearing new projects related with health. An example of that is that we have two. I was looking at the panel. Two of the selected ones are projects that have come from our business school. No, our entrepreneurs who created the project inside the business school. No, for us this is a very interesting thing that. They are not only always until now the project go to the IT, but it's true that for us it's more easy for our investors to invest in medical device more than biotech. For investing in biotech, we always follow the medical college and BioCAD what they suggest to our investors. No? But when one of our investors take the initiative to invest directly, is mainly in medical device and also in health projects.
I will state the obvious. There is a big discrepancy between the US and Europe. It's much easier to scale a company in the US, so that's why we are looking, especially if you are in a B2C What we are looking in Europe is, high barrier to competition, like in genomics. We invest in Sophia Genetics, for instance, or multi-parameter, where you have basically the combination of a device and an app. There is obvious difficulties to scale in Europe compared to the US. So when we look at a company, we look at a company that can go on the other side of the pond relatively fast.
Furthermore, we have to remember that there is a certain clash between a conservative environment, which is a clinical environment and hospitals, and then you have tech firms that are dynamic and have some very innovative approaches. So what we have seen in the last, let's say, 24 months is that it's, even if you have a great approach and a great team with a fantastic idea, to find the right partners in that current existing industry, like hospital environment, that is never that easy. And to find a startup that is able to really adopt and then to be able to build this communication with the current existing hospital group is also very challenging. So if there are young companies that really can create the bridge between their solution, their innovative approach, and their product, and into a daily existing hospital environment, let's call it, that is the added value. And here the competition among German, Polish, and UK-based startups is really tough. So we are looking forward to see something from that.
Well, what I can say is that looking at the past, there's been quite a strong supply, but still the demand is not ready, or it takes time for the demand to be ready. And we are looking also at different ways of penetrating the markets with our startups by using some cross-border type of investing and some localized investors which can better enter and speed up the entrance into the market of some of these startups in the different hospitals and different clients in different countries, as they all have their own way of purchasing, and therefore probably we need to rethink how we invest in this company and who are the investors in this company to help them scale up quicker, especially within Europe.
So on a more optimistic note, there's actually an area within Europe that's thriving, and that's in part due to some regulatory changes that are requiring more digitization within the clinical trial space. So that's an area that is a big area of focus for us as a pharmaceutical company, venture capital group. And we're looking to try to invest in those areas: patient recruitment, patient engagement, structured data analytics, real-world evidence, to try to add value back to the mother organization. But also I think there's tremendous ways that we can bring efficiencies, both in terms of time and cost, to clinical development, so we can really accelerate drug development in a way that is quite innovative. And there's a much bigger focus on that sort of innovative clinical drug design within Europe versus the US, driven in part by these changes in regulation.
A lot has been said already, so I'll double back on things that have been said already. Actually, to come back on the regulatory part, one thing that makes the space more and more attractive from an investor perspective are the change in the regulation that makes business model viable. And in the case of Europe specifically, if you've followed the regulatory changes, and the eHealth Hub has been doing a really great job at doing this, you see that there are new business models that are possible thanks to regulatory change, such as reimbursement of remote monitoring from chronic diseases, right? Or reimbursement of teleconsultations, which I think that did not exist before in Europe in specific cases. So even though these are not necessarily groundbreaking technology as such, these enables really new value proposition to exist, and from an investor perspective to create, I would say, interesting investment cases. The second one, I think, is the interesting point from the switch from the pure technology to the service. And interestingly, maybe in prevention, if you look at the space of prevention before, everyone was creating apps and saying they were doing prevention. So apps that would train you how to eat better or how to exercise better. Now people, if you look at the different companies that have been chosen for the NHS Digital Diabetes Prevention Program, for example, these are not just apps. These are actual prevention programs with coaches that are using technology in order to bring these prevention programs at scale. So this is really a shift that we're seeing, that I think is going to keep existing in the future.
I would say one thing that's changing significantly is the ecosystem that we see in Europe. So in the US, the ecosystem has been very well established for quite some time. And now in Europe, we're seeing more and more that we have, I guess, the environment that can foster startups and really give them, I guess, the advice and I guess the use cases that startups will need to make them relevant in the market. So then we see this in the form of more accelerators being formed, both regional and more broadly across Europe, and also the participation, I think, from the bigger companies. So pharma is becoming very much more involved with the startups, again, whether this be through an incubator or also through case studies and project collaborations, which are then really refining the use cases for various offerings.
I don't know if there's anything to add. Let's see, 1, 2, 3. No, I would just say, from my point, I think we'll see continued push on outcome, which means verticalization, which means population health management. And so solutions that can really go quite deep with deep science and health involved, but not just point solutions. So that would be my look to the future.
Thanks for very, very interesting opinions. Next question, we're going to invert the order of, so that you could find, from an investor's perspective, to get money out of an investment, I think we all will agree in that the investment, the company that we invest in needs to solve a problem, obviously. And if we want to make a lot of money out of an investment, the company needs to solve a very big problem. We are very used to see sometimes people that identifies a problem and comes to us with a solution, a very interesting one. Now and then we see as well people that have very beautiful solutions, that they are actually looking for the problem, which have different rules, isn't it? So I would like to focus on the problem in my next question. What are the big problems that are still unsolved that we could, from the e-health perspective, help in solving? And I will start myself just introducing two problems that I think are very interesting. One of them was commented by one of you, the drug development tools that could help drug development in the industry. That would be very interesting. And of course, in the era of the genomic, the CRISPR era, where we have a vast amount of data that we need to analyze, not only analyze, to understand as well. Any tool that e-health could offer as well to help us understand those data would be very meaningful and solving a very big problem for the future. We're starting over there now. Yes.
Whoa.
You first.
Big question. What's left on the tackle? I think it's actually deeper deployment is the biggest problem of a lot of solutions that are out there today. Yes, some need to be stronger, but I think it's the adoption curve moving as has been discussed, and that, the engagement and deployment. But once that starts moving more rapidly, and it depends how you want to segment digital health in this case, because are you looking at it in which sector of digital health, therapeutics or clinical trial or so on and so forth. But I think it's the adoption, and then there are open areas left to explore, yes. more orphan disease areas that haven't been tackled, and there's some new startups that have come through but haven't, not the diabetes or these kind of things. So that's next.
The top one. Just one element where I think digital has a lot to offer is in data collection. So data collection, which we do have a lot of data, but right now we have many diseases that are so multifactorial, and we actually don't know the single cause, and probably because there is no single cause. So through longitudinal data collection and refining how we do that on a broad scale, I think will make a great impact in our ability to dissect and understand multifactorial diseases.
I think where digital has a lot to bring is in patient engagement or consumer engagement in general. I think if you look at how individuals are engaging with digital technologies outside of healthcare, it's quite impressive, and when you look at healthcare, it becomes a little less impressive. And so I think there is still a lot to do in order to take the best practices from outside of healthcare, in healthcare, in order to engage patients in their disease management or prevention or whatever that is, and use all the benefit of digital technologies in order to better engage patients in their therapies.
So I would certainly echo that data aggregation and analytics is an area that is under-focused at the moment. One of the quotes that I heard was that in 5 years' time, a single clinical visit is going to generate 5 terabytes of data. Right now, only about 3% of those data are structured. So what do we do with the rest of the 97% of the data that we're collecting and not using? How do we use data algorithms and analytics and AI to just take out what's really clinically meaningful and clinically actionable for physicians so that you can really see an impact for change in the way we practice medicine. So it's not only trying to do trend analyses for predictive medicine, but it's also within a particular indication, how can we predict exacerbations or prevent hospitalizations, and I think those are the areas that are going to need our focus going forward. I will not to take a contrarian view, but I will take a slightly different view in terms of how we can make money as digital health investors, sometimes by solving a very small problem. And if we solve enough small problems and put them together, I think we have the potential to solve very, very big problems. We are ecosystem investors, so we try to answer broadly what's the problem, what's the job to be done, what's the problem to be solved, and then make individual investments to try to carve away, at that problem. With the idea that we would group or bundle assets or companies together in a way that's meaningful. So I think we have to start out with trying to solve the big problems. But the individual companies, particularly the ones of the size that many of them exist in Europe, they're not going to answer the whole problem. So we have to kind of break it down and say, well, this, it's almost like a puzzle piece. This will answer this will answer this. Together, if there's appropriate interoperability, can we do something much more meaningful than what these individual companies can do on their own?
Very sure. Thank you.
Well, to contribute a little bit on that, always when you solve a problem, it doesn't matter if it's in school or in daily work, it's we have to look a little bit at the bigger perspective. So the actual problem can be, for example, overpopulated countries that have no access to any sort of healthcare, and then how is technology gonna help there, correct? So we have to look at the bigger picture. We come from a modern part of the world and have brilliant opportunities, but the challenge that we have seen is also how to adopt a good technology in a more remote area. So there's one particular challenge that hasn't been yet very explored, so there's probably a lot of room for improvement and innovation. And I think that companies that will have some impact there have a very bright future, and especially from an investor perspective, something very interesting and always worth to dig into and to explore. And these very populated countries, how they adopt new technologies in healthcare and digital health, because it's a little bit behind there sometimes. Yeah.
My computer was not working. Just, I think very quickly, I believe one sector is for sure these platforms that are going to accelerate the possibility for developing drug candidates. We have invested in a couple of companies, and this is a sector that is coming up in a strong way and will significantly, I think, disrupt the market. And then probably, I mean, a lot have been already. I think that again, you know, there could be a focus also on activities or startups that will be looking at how to lower the barriers to entry and entering, you know, the market of this type of products in terms of processes, procedures, authorizations, and so on and so forth. Perhaps that's an area also to look at.
So I'm probably one of the oldest in the room. I've lived basically several cycles, including internet, and you know, maybe I can share with you how it looks like when I met the first time the people at World Wide Web out of CERN in '93. So we are a little bit at the stone age, I think, in the health tech, and that's the good news and the bad news. And what I learned from those experiences is not only to have the vision of what service, of what technology will happen, but more about when it will happen, and also what is a domino that needs to happen in order for that technology to be successful in the market. So I think we can all figure out, you know, what will work. We can come with buzzwords, but very few of us will be good in timing the investment, and I think that is a art. So I see several areas. There are areas that are completely virgin, that none of you or none of us know about, that will emerge as huge markets. So and I have an analogy with a pulse oximeter for the one who are old enough to remember that. And NetCore, they invented a new area, and I think there are many of those new area to invent. And of course, we are working on some of them, and I will keep that for me. Then there is drug adherence. Drug adherence, we are, I think, a huge opportunity. Now, the way to tackle it will be difficult, and I think the successful people will come from adjacent markets, not necessarily from, you know, all the companies that are trying to compete with a smart, you know, box and you know, taking pictures, etc. So I think adherence is huge. Behavioral health is an immense market, and again, in behavioral health, what is difficult, there are so many companies. We're just finishing a report, it's like 70 pages, internal report, and it's absolutely crowded market. But there are some angles in behavioral health that will make basically the accession to the market easier, and we will see for sure many successful companies in behavioral health, because it's a huge market. And last but not least, I like areas which are convergence areas, and I think, you know, for people like us who invest in genomics, you know, genomics is one part, but you need imaging, you need proteomics, and the company that can combine all this technology together will be, you know, the dominant player. It's just not having one point to be the best in one thing. You need to provide to the hospital a full solution.
Well, according to the interests of our investors around the world, I would say that many times they are not only interested in great challenges, but in small, I think one of you have told us, small changes that adapt new technologies to improve or to improve the efficiency of the treatments, of the process of the information. I think this is for, I would not say that we are all thinking in great challenges, but small, but efficiently.
I think some of the more boring areas, I would say, are underinvested, right? So the less exciting areas are something that I haven't seen a lot of innovation in, and I think is health systems, hospitals generally don't have the tools to be able to manage themselves like a business very well. Some of that comes down to not really understanding where their costs are at a very micro level. So both time and activity-based accounting is what a lot of them do, and none of them do it well. So I think if we're really going to kind of bend the cost curve, we need to be able to provide the insights to help health systems manage themselves better.
I will break down my answer in two parts. One, clinical opportunities. I think we are still trying to break into the area of cardiovascular. There's still a lot of opportunities to do meaningful outcomes in this area, as well as the brain. And that for me is a huge area of opportunity that goes from mental health to extracting new information from existing images about the brain. The second answer is on technology opportunities that are still open. And there I'm very excited about what will come on machine learning applied to vision. I think we're finally starting to get traction in clinical decision support, solutions that really enable the physician to be quick in acting. We're finally getting some clarity in the United States when it comes to the regulatory framework for these technologies. Unfortunately, it's not the kind of clarity that we had hoped for. The clarity is better than uncertainty and hope. And the second, I would say the second technology opportunity that is still uncharted is new data. We had the genome, we had the microbiome, next we're going to have the screenome, and there's still a lot more that we can do to create information from things that we're not measuring just yet.
Okay, last. I'm a bit surprised that nobody mentioned it. I think one of the biggest problems we really have in healthcare is costs. So everything that can bring down costs will help greatly. And there are more people that are living longer and that want to have better medicine. And digital solutions are dearly needed to cope with that. I was quite surprised actually recently to see how that is being dealt with in China when they use WeChat for almost anything, also for basically for their patient data. I think probably here in the West we can start to learn one or the other thing from China.
Thank you. Time flies, but we still have time for one or two questions. I would like to open the questions to the audience as well. You have the opportunity to ask all those investors about anything that worries you or anything you want to know. But I will ask the investors not to go to the full circle, but just to answer one or two of you. Please, go ahead.
What's your view? Where do you see the new challengers to come? From people that are already in the system or from outsiders?
Very interesting question. Who wants to answer the question?
So I think the short answer is that we have no idea. I think a lot of them will come from the known players. A lot of them will come from players that are becoming more known to us, the Apples, the Googles, the Amazons. But what I also predict is that there's an entire wave that no one, least of which is pharma, is really expecting to hit.
Anyone else wants to provide an answer to that? Another question from the audience? You nailed it, yes. Any more questions? Well, in fact, the timing is very... we need to stop now because the important thing today are the pitches, the presentations from the entrepreneurs. So I'm going to ask... I want to thank you all for all your insights and being at this round table. And I'm going to ask Neil Patel and Dario Mazzella, are they around? Yes, to come up because you're going to moderate... sorry. You're going to moderate. Yeah, easy enough. And the rest of us, members of the jury, we're going to go down.